Okay, so this is the cervical vertebrae. We're going to look at C1 first, otherwise known as the atlas. So it has a posterior tubercle, has a posterior arch, has a vertebral foramen that houses the spinal cord. Not shown is the transverse ligament for the atlas that goes across the foramen, and it would make the foramen for the dens. It also has an anterior arch, an anterior tubercle. It has a facet for the dens. It has a lateral mass, and on top of the lateral mass is the superior articular facet. It also has a foramen transversarium, a transverse process, and a groove for the vertebral artery. Moving along to C2, the axis. C2 has a bifid spinous process. It also has a lamina, has a vertebral foramen, an inferior articular process. It has a transverse process. It has a superior articular facet. It also has a dens, and on the back side would be the facet for the dens and the body. Okay, moving along to C4. Now C4, C3, and C5 all have similar features. So on the transverse process, we will look at the posterior tubercle, the anterior tubercle, and in between is the groove for the spinal nerve. It also has a foramen transversarium. These vertebrae also have bifid spinous process. It has an uncus of the body and the body. It also has a inferior articular process that houses the inferior articular facet, and also has a superior articular process for the superior articular facet. Now the difference between C3, C4, C5, and C6 is that C6 has a carotid tubercle. And the difference for C7 is that C7 no longer has a bifid spinous process. It does not have anterior or posterior tubercles, nor does it have a carotid tubercle. Moving along to T1. T1 has a spinous process, a lamina, a transverse process, the pedicle, the vertebral body, and the vertebral foramen. So as you look at the spinal cord from T2 to T12, you can see that the spinous processes are first elongated and thin, and then as they go down they get shorter and thicker, more resembling the lumbar spinous processes. And if you look at the bodies begin small, and then as they go down the vertebral bodies get larger to resemble the lumbar bodies. Okay, this is T1 through T12, and this is a lateral view. So this would be a superior articular process and a superior articular facet, and also have an inferior articular process and an inferior articular facet. Then we have a transverse process. On the transverse process would be the transverse costal facet for attachment of the ribs. Then you have a superior costal facet, an inferior costal facet. We also have the spinous processes of the thoracic vertebrae. And on T12, it differs from the rest since it has a mammillary process, an accessory process, and a transverse process.